Alzheimer's disease isn't just something I've studied, it's something that has directly impacted my family. My husband lost his grandmother to Alzheimer's. Now his mother is in the early stages of dementia. Watching this progression has made me deeply concerned about what this could mean for his cognitive health as well as our children's.
Our group consists of Tisha, Nassim, and Kate. We're ABSN students at Elmhurst University who have been reviewing research on cognitive exercises that may improve function in individuals with Alzheimer's disease.
Here's an image of our EBP poster. Through this PowerPoint presentation, we will be breaking this apart to look at independent sections. At the end of this, you will again find the image alongside a QR code for more detailed access to the poster and its data.
For our project, we wanted to find out if cognitive exercises or like programs can help adults with mild to moderate Alzheimer's disease. More specifically, we compared these programs to the usual care to see if they could improve memory, thinking, and the overall cognitive functions.
Alzheimer's disease is associated with progressive cognitive decline, leading to decreased functional independence and quality of life in affected individuals. Cognitive impairment also contributes to increased caregiver burden and increased need for long-term care services. Standard care primarily focuses on pharmacologic management. However, non-pharmacologic interventions such as cognitive stimulation therapy and structured cognitive exercise programs are emerging as effective adjuncts to support cognitive function. Nurses play a key role in implementing and supporting these interventions in clinical and in long-term care settings. Improving cognitive outcomes through structured programs may enhance patient function, support independence, and improve overall quality of care.
For our methods, we looked at research articles from trusted medical and nursing sources. We searched for studies about Alzheimer's disease, dementia, cognitive stimulation therapy, and cognitive exercises. We focused on studies with adults that had mild to moderate Alzheimer's or dementia. The studies compared cognitive stimulation therapy to the usual care. Cognitive stimulation therapy means structured brain activities like memory practice, language activities, and problem solving. We chose stronger studies like research reviews and controlled trials, and then we looked at the study size and the results and how strong the evidence was.
Cognitive stimulation therapy, CST, demonstrated significant improvement in cognitive function in patients with mild to moderate Alzheimer's disease. CST can be implemented in clinical and long-term care settings through structured group or individual sessions, for example, 2 to 3 times per week for 30 to 60 minutes, focusing on memory, orientation, language, and problem-solving activities. Expected outcomes include improved cognitive performance, reduced depressive symptoms, and increased engagement in care.
In this slide, we're looking at cognitive function measured by the MMSE in individuals with Alzheimer's disease. On the left, the overall scores increase from pre to post-intervention, showing improvement after cognitive stimulation therapy. Although there's a slight drop at follow-up, scores remain higher than the baseline, suggesting lasting benefits. On the right, each line represents an individual participant. Most show improvement after the intervention, and many maintain higher scores over time. Overall, these results suggest that cognitive stimulation therapy improves cognitive function and helps sustain those gains. In this slide, we're looking at changes in cognitive function using MEC 35 scores from baseline to post-intervention and at a 6-month follow-up. After the intervention, the group receiving cognitive stimulation therapy improved more than the control group, with a difference of about 1.9 points, which is statistically significant. At 6 months, the improvement is even greater, with a difference of about 2.3 points, again showing statistical significance. Overall, the data shows that cognitive stimulation therapy leads to greater and sustained improvements in cognitive function compared to usual care.
For the nursing practice, nurses have an important role to play in supporting cognitive stimulation therapy. This means nurses can help teach patients and caregivers, guide brain exercises, and watch for changes in memory and thinking in terms of patients. Some barriers can make this harder. Barriers are things that will get in the way. These barriers include things like limited staff time, not enough training, and patients participating differently. As Alzheimer's progresses, it can also become harder for the patients to stay involved. Another important part is consent. Consent means that the patient agrees to what is being done. And because Alzheimer can affect decision-making, nurses need to protect the patient safety, dignity, and wishes. Overall, more research is still needed to find out which parts work best. But the evidence shows that cognitive stimulation therapy can be helpful in dementia units or in dementia care.
In conclusion, studies support cognitive stimulation therapy as an effective non-pharmacological intervention that improves cognitive function in patients with mild to moderate Alzheimer's disease. Nursing practice could adopt cognitive stimulation programs as part of routine dementia care, even as research studies continue to learn more about the extent to which specific cognitive exercise components improve cognition. And implementation of structured cognitive exercise programs in clinical and long-term care settings can enhance life for patients with mild to moderate dementia.
If you would like to take a closer look at our scholarly references and EBP poster, please feel free to scan this QR code. Thank you so much for watching our presentation.